Hi, I am Linda, welcome to this video. In this fast-paced world we live in, it can take a toll on our bodies. Feeling intermittent aches and pains has become a worldwide occurrence, whether it's a result of strenuous exercise or simply getting older. Finding relief from these discomforts is common. I am not a medical professional, and the information in this video is for informational purposes only. In today's video, I will explain what you need to know about psoriatic arthritis, including what it is, how to diagnose the disease, its symptoms, and how you can live comfortably. But first, do not forget to visit my website, where you can learn more about this terrible disease. Did you know that there are 100 different types of arthritis, and psoriatic arthritis is just one of them? The condition can attack your joints, including your knees, ankles, hands and feet. It can also affect your skin, nails, spine, and even your tendons and ligaments. The condition can progress over time, and in severe cases, joints may become permanently damaged or deformed, possibly requiring surgery. However, early diagnosis and treatment can slow its progression and reduce joint damage. Psoriatic arthritis can look a lot like other conditions at first and is difficult to diagnose. But if you already have psoriasis, that itchy, flaky skin condition, your chances of developing psoriatic arthritis are much higher, and it can develop in about 5 to 10 years. The condition varies greatly from person to person. Some experience mild symptoms in just a few joints, while others may have more widespread pain or go into remission. In rare and severe cases, psoriatic arthritis may develop into arthritis mutilans, a highly disabling form that causes joint destruction, especially in the hands and feet. This form may also lead to bone fusion and deformities. Symptoms include intense joint pain, finger shakiness, and nail issues like thickening or lifting of the nail from the nail bed. Prompt treatment is crucial to prevent permanent damage. Psoriatic arthritis is a chronic condition that affects both your joints and skin. But the symptoms can look different from person to person, and sometimes they are easy to miss. One of the most common symptoms is joint pain, stiffness, and swelling, especially in the hands, knees, feet, and ankles. You might notice stiffness in the morning that improves with movement. This is known as morning stiffness. Another sign is dactylitis, or sausage fingers and toes, when whole fingers or toes become red, swollen, and painful. Some people also have enthesitis, inflammation where tendons and ligaments attach to bones, especially in the heel or elbow. Nail changes are another telltale sign. You may see pitting, discoloration, or even separation of the nail from the nail bed. Don't forget the skin. Psoriasis causes red, scaly patches, often on the scalp, elbows, or knees. Other symptoms include fatigue, eye inflammation like uveitis, and a general feeling of being unwell, especially during a flare-up. The last symptom is peripheral arthritis, which involves pain and swelling in joints such as the hands, arms, feet, or legs. Symptoms can appear slowly or suddenly, and they may come and go. But if you notice any of these signs, especially with a history of psoriasis, it's time to talk to your doctor. Genetics and environmental triggers like infections may play a role in developing psoriatic arthritis. If you have a family history of the condition, or if you're overweight, your risk increases. Psoriatic arthritis most often develops in adults between the ages of 30 and 55, but it can occur at any age. People with the condition are also at higher risk for other health issues such as cardiovascular disease, hypertension, metabolic syndrome, and diabetes. Diagnosing psoriatic arthritis usually involves a rheumatologist, who may order blood tests, imaging like X-rays, and assess symptoms such as joint pain, nail changes, and a family history of psoriasis. Questionnaires and physical exams are also used to distinguish psoriatic arthritis from conditions like rheumatoid arthritis or osteoarthritis. As the disease progresses, flare-ups may become more frequent, and mobility may decline. Damage can also extend beyond the joints, affecting organs such as the heart, eyes, or inner ear. However, lifestyle changes can help manage symptoms and improve quality of life. Using adaptive devices at home, like kitchen tools or stair lifts, avoiding strain on painful joints, and losing excess weight can all reduce pressure on joints and ease symptoms. Treatment aims to reduce symptoms and slow the disease's progression. Options include NSAIDs, non-steroidal anti-inflammatory drugs, such as ibuprofen or diclofenac, which relieve pain and inflammation. Gels like Fenbid can be applied topically for localized relief. COX-2 inhibitors, a newer class of NSAIDs, are also effective, but may cause stomach upset or ulcers. DMARDs, disease-modifying antirheumatic drugs, help stop the immune system from attacking the joints, but can cause side effects like nausea, rashes, and liver issues. Corticosteroids are used to reduce inflammation quickly. These can be injected into a single joint or taken as tablets, but may cause weight gain, acne, mood swings, and skin thinning when used long-term. Biologic therapies are newer treatments for people who don't respond to DMARDs. These drugs block specific immune signals. While effective, they can cause redness at the injection site or more serious effects like liver or kidney problems, so regular testing is required. But medication isn't the only way to manage it. Simple lifestyle changes can make a huge difference, such as small changes like help with getting around or by using assistive tools at home, such as kitchen tools or stair lifts, and using two-handled pots. Avoid straining on your painful joints. You should keep a healthy weight and eat healthy meals such as fresh fruit and vegetables, and try and avoid sugary snacks like cakes, chocolate, etc. Psoriatic arthritis doesn't have to control your life. With early diagnosis, proper treatment, and a bit of self-care, you can reduce symptoms and stay active. Listen to the rest of my video, and I shall show you which food to eat and what to avoid. The next section is about the risk factors, which include having a family history of psoriatic arthritis, being between the ages of 30 and 55, being overweight, or having had physical trauma. Smoking and certain infections can also raise your risk. Psoriatic arthritis is an autoimmune condition that affects the joints and skin. But not everyone is equally at risk. So, who should be watching for the early signs? First and foremost, if you have psoriasis, your chances are higher. Up to 1 in 3 people with psoriasis may develop psoriatic arthritis. Family history matters too. If your parents or siblings have psoriatic arthritis, your risk increases significantly. Age plays a role. Most people are diagnosed between the ages of 30 and 55, though it can occur earlier or later. Being overweight or obese also raises your risk. Extra weight puts more pressure on joints and increases inflammation. Smoking and exposure to certain infections, especially viral or bacterial, may trigger the disease in those who are already at risk. Physical trauma or injury, like a car accident or sports injury, has also been linked to triggering psoriatic arthritis in some people. And gender. Psoriatic arthritis can affect men and women equally, but symptoms may look slightly different from person to person. If you already have psoriasis, or have any of the above signs, talk to your doctor. You may be referred to a rheumatologist who'll do blood tests, scans, and a physical exam to rule out other types of arthritis. In conclusion, psoriatic arthritis is a serious condition that affects both the skin and joints. With early detection, proper medical treatment, and healthy lifestyle changes, you can manage symptoms, slow its progression, and maintain a good quality of life. If you notice early signs, such as joint pain, nail changes, or persistent fatigue, don't delay. Consult your doctor or a rheumatologist for a full evaluation. Use assistive tools at home, eat well, exercise gently, and manage stress. Even small changes, like using two-handled pots or stair lifts, can reduce strain on your joints. Psoriatic arthritis doesn't have to control your life. With early diagnosis, proper treatment, and a bit of self-care, you can reduce symptoms and stay active. If you're worried about joint pain or have psoriasis, don't wait. Talk to your doctor today. Catching psoriatic arthritis early can make all the difference. Thanks for watching this video. If you found this video helpful, please subscribe to my channel and click the bell icon and explore more on how to protect your joints and manage your health. I am not a medical professional, and this video is for information only. If you have concerns about your condition, be sure to consult your healthcare professional. If you have any questions about this video that I have not covered, or found this video helpful, I would like to know. Just leave a comment below, and I will get back to you. Don't forget to click on my next video on what to eat and what to avoid with painful joints. I hope you found this video useful. Good luck and see you next time.